Hello guys, welcome to Where Your Health Matters with Elizabeth. Today, we'll be looking at a disease that is deadlier than HIV. Do you even know there is a disease that is deadlier than HIV? If it's not, come, move closer. Don't scroll down, just move closer and let's talk about it. So we're looking at hepatitis. I'm sure you have been hearing about hepatitis, maybe you just hear randomly or like child heard of it. And if not heard of it, just come close, don't scroll down, just stay there and let us like dive in and talk about it so you'll be able to grab one or two things about it. So hepatitis is one disease that affects our liver. And we all know that we all have just one liver. Once the liver is damaged, that's it. Kidney can be damaged and still like get transplant. Though some people can get liver transplants, or who's ready to die for one another. We're not Jesus. So we're looking at hepatitis. Hepatitis is the inflammation of the liver, often caused by viruses, but sometimes it can result from other factors like alcohol use, some certain medication, and autoimmune diseases. It can be acute or chronic depending on the causes and its severity. Having an interesting topic that I want to talk about today, I won't be doing it alone today. I will not be doing it alone. We have a guest who is happy. We have a guest. So this guest is a sister, she's a friend. She's not just any other person, she's a graduate of nutrition and dietetics at Ladoke Akitola University of Technology, Ogbomoso. She's a nutrition educator. She's a project manager. She has managed a whole lot of projects. She has managed projects a whole lot. To mention a few, she's one of the project manager of Empower Project by TGNC, the Global Nutrition Community. She is also a bachelor assistant at TGNC. She has done a lot, So come with me to welcome.
Thank you for having me on this show. Thank you for having me at Where Your Health Matters.
Thank you for doing our call. And looking at hepatitis, I realized that hepatitis kills faster than HIV. Like it's deadlier than HIV. So we wanted to enlighten our viewers some more on hepatitis.
Which is caused by virus, sometimes alcohol, sometimes missions, use of non-steroidal medication, and sometimes your immune system. So then I'll be talking about the types of hepatitis, because we have different types of hepatitis. We have hepatitis A, we have hepatitis B, we have C, we have D, and we have E.
Thank you. Before we dive in further, please don't forget to subscribe, like, and share. Thank you.
I would love to explain the types of hepatitis one after the other. Then I'll start with hepatitis A. Hepatitis A is caused by virus, which is transmitted when you ingest fission materials containing the virus. And the best way to prevent this is through vaccination and practicing of good hygiene by washing your hands before and after using the toilets, and avoid consumption of contaminated food and water. This practice helps reduce the risk of hepatitis A. So then I'll move to hepatitis B. Hepatitis B is the deadliest of all hepatitis. That hepatitis B even through sweats, like body fluid, blood, semen, how you actually cause with a patient that has somebody that has hepatitis B. So you can contact hepatitis B through that. So through sweats, can you just imagine contacting hepatitis B through sweats? That's how deadly hepatitis B can be. So, and it can also be passed from mother to child during childbirth, and it can cause both acute and chronic infection and can lead to liver cirrhosis and liver cancer.
Well, you said something earlier that hepatitis B you can contract it to bodily sweat. Like,
Yes. So
wow.
the symptoms of hepatitis B can vary from individual. So it can show and it might not show different individuals. Some individuals may not have the symptoms for years, and the only way you can prevent hepatitis B is through vaccination. It actually does not have a special treatment for now, but the only way you can prevent hepatitis B is through vaccination and supportive care. That is for those that have complicated. So supportive care such as rest, proper nutrition, staying hydrated, monitoring the liver function, and regular follow-up by healthcare personnel or professionals. Hepatitis C is also caused by a virus and it can be transmitted through blood contact. That is contacting hepatitis C through infected needle, like sharing of needle and then improper sterilization of the medical equipment. So these things can actually cause hepatitis B, like can transmit, can contact through these things. And chronic hepatitis C can lead to long-time liver damage, and to liver cirrhosis, and lead to liver cancer, and total damage of the liver. So, and the only way in which we can solve this problem is through liver transportation, like transporting the liver to the body, which we know is not going to be an easy thing. So, and it's also in that the symptoms might not appear for years. It might not appear at all, like till the liver, even sometimes until the liver has been totally damaged. That's something hepatitis C too. Now let's look at hepatitis D. Hepatitis D is also known as delta hepatitis, which is caused by hepatitis virus too. So, but unlike other types of hepatitis, like it does not, its own infection does not stand on its own, like it does not cause infection on its own. For somebody to have hepatitis B, the person must have had hepatitis B already. So hepatitis D developed from hepatitis B, which is why health professional call this hepatitis virus satellite virus, because you cannot just contact hepatitis D without hepatitis B. That is why if you want to treat hepatitis D, you have to treat hepatitis B, and this can be done properly by proper vaccination, practicing a safe sex, avoid sharing of needles, and other preventive measures like avoid body contacts. I'm not saying we should not have contact with people, but we should know, like, practice precautions when we move closer to people, because we don't know who it's from.
Thank you for that.
So when we talk about hepatitis E is similar to, the process is similar to that of hepatitis A. Like hepatitis E, you can contact that through eating or consuming contaminated food and drinking contaminated water. So, and poor hygienic practices. So that is why we should always keep our surroundings clean and practice good hygiene practices. So, and then that's drinking of good water and avoid contamination of food. Most of us that love eating food, please, anytime food is ready and we're in the toilet and just use the toilet, let's please wash our hands with soap and water. If possible, let's sanitize our hands. Like I said earlier, the symptoms can vary from individual, and some don't even show the symptoms till their liver is totally damaged. But I would say some common symptoms you can see. Okay, for those that symptoms shows in them. So we have like the person will be tired, constant tiredness, loss of appetite, vomiting, dark urine, joint pain, abdominal pain and discomfort in your abdominal area. Then jaundice. When I say jaundice, that's having yellowish eyes, like your eyes will just have this yellow color. Then your skin too, not just your eyes alone, and also your skin.
Thank you so much. Thanks for the lecture so far. Thank you. We really learning notes. Thank you so much. I guess I'll like talk about everything about hepatitis. Thank you so much for the short period. So grateful. I've learned a lot about hepatitis. So next week looking at how we can manage hepatitis through what we are eating, our dietary management of hepatitis. So please, I beg you, please subscribe, like, share, and also if you have any question, you can send it to the comment section. We'll be willing and eager to reply you to answer all your questions. Thank you so much. See you next week. Bye.